morning, everyone.
Good morning.
Are we missing people? Just squished up.
I started again.
Trying to get close to each other already.
I need to lay down.
We're on a new stroke today. Had to do with Ephrod yesterday. Yeah, loved it? Totally natural?
No, totally.
Some of you look like you were having trouble balancing, but the floor wasn't moving. Why can't I stand?
Yeah, my socks like made me slide over the place.
Yeah. See, now I use socks as tools, you know, like I can slide, I can aim the sliding. So we practice the sliding part. That becomes a whole new thing. We'll actually do a dancing day about that. So today's stroke is on page 14 in your book. Next one. Ready for the next one? You've already mastered Ephrod. Everyone say Ephrod. 1, 2, 3.
Ephrod.
Good. Don't you feel French?
Oui.
Okay, so who wants to read about the next stroke, which is called petrissage? Let's try that one. 1, 2, 3.
Petrissage.
We usually start mixing up names by the third day and start hearing things like pepinage and effitage and all kinds of weird stuff. Who's got a radio voice? Amber. Amber has a radio voice. Let's hear
I've
it.
been told. Strokes which need repeatedly lifting and grasping and releasing tissue. Lifts muscle mass and wrings or squeezes it gently. There is no gliding except for moving to another area.
Okay, so hold on a second. How does that sound different from yesterday? Yesterday was gliding. Today is no gliding. So how would that look if you were lifting and grasping and releasing the muscle mass, wringing and squeezing? Try it on your forearm. What would that look like? Say it again.
Like you're breaking up lettuce.
Okay, like breaking up lettuce. You ever seen a cat do this?
Yeah.
Which is why it's called petrissage,
And they do that.
because pets do it. So it looks like this, pressing down into the muscle and then squeezing into it gently and lifting the mass of the muscle. Try that out. So notice that that's not a gliding thing. What happens to your arm if you glide off of there? Nothing. Okay. So if you compress the muscle and then lift it with a little squeeze, what's happening to it? Notice the list.
Milks the muscle waste products.
Very good. You are quick. Milks the muscle of waste products. That is amazing and scientific sounding at that. What kind of waste products would be in there? Toxins. I love it. This is one of my favorite things. What toxins?
Lactic acid?
Lactic acid's not hanging out in there. No.
Carbon dioxide.
Carbon dioxide, a byproduct of metabolism, not a toxin. You're not really toxic, is my point, but we'll get to that in anatomy class. There are byproducts of you being alive, and they're in the tissue, and moving the blood through there more efficiently helps move stuff out of there that could become stagnant. Some things, if they build up to a toxic level, can cause trouble, but in general, you don't really produce toxic material.
What about tartar and plaque? That's the yesterday. Maybe not the plaque, but there's just talking about tartar. Oh, it's not the plaque.
He's talking about the varicose vein in your arteries.
So when you do that, does that have to do with the tartar?
buildup.
Oh yeah. So I don't know if Paul told you this in enough detail, but if you were to release something like that from somebody's vein, they would be screaming their head off. Like you can't do that really without knowing it. You know what I mean? And you'd be having to tell them to shut up and let you keep going in order to get there and make that happen. So you don't have to have those kind of worries right now. Especially because even at this point, you're probably holding back from putting your full pressure in, right? Like yesterday, you were probably hearing from your client.
He had like a rock leg, and I don't want to make him cry.
But yesterday, usually on the first day, we do a lot of.
I couldn't hit a muscle on his leg and do that, so I don't want to care for him now. Because, grabbing it and picking it up, it's not possible to move that on some people.
Okay, so what would you do? How would you work with that then? So tell me about the muscle. Can you picture the muscle tissue like a sponge? Can you picture that the blood moves through the muscle tissue in one direction, right? Comes from the arteries, goes through the muscle, and then out through the veins back to the heart.
Right.
So if it goes one way only, that means if you push on the muscle tissue and you compress it, you push all the liquid out of it, and then when the sponge goes to soak up the next liquid, it's got to be new blood.
So then,
Does that make sense? So you're helping it either way. Whether you feel like you can differentiate a muscle or not, you're still helping the muscle tissue by
so
doing
if
this
you
stroke.
can't grab it, then you just press down on it.
Well, so one of the pieces of this is really important. Try these different hand shapes. If you make a C out of your hands and put that on your forearm and grip in there, press down and grip in. Does that feel as good as it did before? Feels a little more grippy, right?
Yeah.
Try making your fingers and thumbs straight instead. Instead of a C shape, make a V shape. And try that. Compress down and then squeeze straight fingers and thumbs. See if that feels different. Okay, so it's a little smoother and it actually does a little more lifting, doesn't it? So you get the idea. What we're looking for is a compression and then a sort of a squeeze lift at the same time. So can you read a little more, Amber?
Ideally, with one-handed and two-handed petrissage, there is no space between the client's skin and the therapist's palm.
Try that on your own. That means that when you compress, obviously your hand is stuck to the skin, right? When you squeeze and then lift, now make sure that there's no space between your palm and the skin. See how that feels? So the whole lifting isn't lifting off. It's really the undoing of the compression. Do you get that? That's the lift. So that's what we're going for today. See if you can really stick your hands down and do the lift that way. Right? So now tell us about the types.
Oh, well, there's one more.
Oh, go ahead. Sorry.
Or two. Also called milking the muscle, this stroke is primarily used on the muscle belly.
Which is where?
The
That's
center.
not the same as the belly muscle.
In the middle.
In the middle of the muscle, right? You want a visual? Give you a little, draw it on board for you. So, and we'll do a lot of this in an anatomy class, but basically when you're looking at the muscle tissue, there's an attachment end here, right? We have the attachments are what? What connects? What do the muscles attach onto?
Tendon.
Well, they attach onto what?
Bone.
Bones. And so what plugs a muscle into a bone?
Tendon.
Tendons. So ligaments plug bones to bones, and tendons plug muscles to bones, right? So the belly is the middle part where the thick meat is, right? So can you picture that that's the part that would benefit milking and milking?
Yeah.
Like how would you milk the little thin end where there's no muscle fibers and it's tendinous tissue that's attaching to the bone?
With your fingers.
That wouldn't be a great place to be milking, right? I mean, this place is filled with blood, right? So, okay, so muscle bellies. So tell me, where would you find some muscle bellies?
Arms, legs,
Forearm, that was a good one.
thighs.
Where else?
Bicep, tricep.
Thighs. Right, quadriceps, good. Calves, that's a good one. Where else?
Neck.
Upper arms, good. Biceps. What else? Deltoids. Glutes. Good one.
A lot of milk in back there.
What about in your back? I mean, any muscle can have a belly, right? They may not be super thick, but your back muscles, even though they're more sheet-like, there are whole areas there that we can work with milking through your back and even in your sides, right? So we're going to do a lot of this, like in the demonstration, you'll see some simple places to start using this, and then as we get to more places in the body, we'll apply this stroke, all of these strokes, to more places, and you'll just keep getting to try them on more and more places. Let's see, what kind of types are there? Any other radio voices in the room?
Yes.
Okay. Will you tell us about the types?
Two-handed alternating lifting, squeezing, and compressing. That's
Okay.
one type. Two is one-handed lifting, squeezing, and compressing. And three is alternating fingers and thumb.
Okay, so they're really just different sizes, right? Either a two-handed, a place that's big enough for both of your hands at the same time, or a place that's only big enough for one hand at a time, or a place that's so small that you might have to use thumbs and fingers instead of a whole hand. Does that make sense? Like, where could you use both hands?
Back.
Back, glutes, thighs, calves, right? Those kind of places. Where could you use one hand? Arms, that's a good spot. Maybe traps, right? And what about where could you use thumbs and fingers?
Neck,
Think about that. This is a tiny tool, right?
neck and
Right?
legs.
So maybe smaller spots. Maybe if you picked out a small spot and wanted to focus in on one place and do some compression and lifting, right? Or tiny places up here. Why don't we try it? Let's get in a circle, scooch in and turn to your right and sit behind the person in front of you and in front of the person behind you. Yeah, you have to scooch in one, like 3 average butt widths. Or 1 average butt length.
No, he's out of the circle here.
I know. More of an egg. Yeah, I'm just gonna work with me.
Oh, you're way over there.
Yeah, this is much.
Now, the best band ever in the entire universe was the Grateful Dead, and their concerts were made of lots of people doing this all the time. So let's try it, because I know this works. So try this on the person in front of you. Find their trapezius. That's your squeeziest, right? Have you done that yet with Paul? Well, that may be today. Pretend that I didn't say that. Right. So find the trapezius in front of you and see how it feels to work in there. Like pick which tool you want to try. You want to try a double-handed? Can you fit both of your hands in one side? Maybe not really. So maybe you have a one-handed petricide, and see how it feels to do a compression and a lift. You may have to use thumbs and fingers in these kind of places, right? And it's not gliding and rubbing. This is a compress and a lift.
So you're definitely using your thumb on this one.
Is my thumb not be like that?
What's that?
Because yesterday we weren't supposed to really use our thumb.
Uh-huh. And now you're working, right? Yeah. So what else? What else do you notice about the difference? Find another place on their back and work like on their scapula. See how that feels. Hard to do? How about their sides, like this, the low back, side of the low back? Yeah. Right?
There's nothing wrong with it, but no, you're just fine tuning this position. Keep it more like muscle down.
All right, so find some muscle bellies.
Back here.
Okay? So what do you notice about this different from yesterday?
We're not
In
sliding.
terms, what's that?
We're not sliding.
You're not sliding. And what else? What's harder about this body mechanics wise?
The use of your hand, you're not
Yeah, that's
Weighing
support
on
on body. You're not working along the length of the.
It's just your hands and arms working right now, right? So this is a lot harder because you don't have your body weight behind it. So today in the demonstration, you're going to learn all about how to get your body weight behind this so that it's your weight leaning into your hands that's doing the stroke instead of your arms and hands working on it. Let's turn around, do a 180, and you'll take care of the person who just took care of you. You have to change your orientation and move closer together. And notice what's different. You don't even have to say this part out loud, but just notice what's different on this body instead of the last body.
Bigger.
I'm stronger. So it's harder, you have to work a little harder when you're working with thicker muscle tissue. So even more reason to work with body. Okay. So this is a lot to focus on today. Let's bring it on back. And maybe don't probably stop. So are your hands, you feel that in your hands right now?
A little sore.
Right? Yeah, probably feel it in your thumbs. So today we're going to extra focus on not hurting our thumbs, right? So you notice just that little bit of work was enough to work your thumbs out, right? We don't want to overdo it on thumbs, so we're going to really focus on body mechanics. It's a big part of today. To work with how to lean and how to aim your fingers and thumbs so that your pressure is coming from your body weight and not your hands working too hard. So what other kind of, and then there are some additional types that you'll see in the demonstration. So circular is, amazingly, it goes in circles. Skin rolling is actually real similar to an ancient Chinese technique in Tulinan, where you're rolling the skin over an area.
Like picking them up and
Yeah, and you'll see that in the demonstration. And then the rolling one is moving the tissue on arms and legs. So
Is
it's
that like
more like a
rolling a
it's
loaf
like
of bread
more-
sort of
it's like
emotion?
And so what other kinds of purposes do you see in this? What would you think of, like, who would you want to do this with?
someone who's stressed, tense, the muscles are tight.
Okay, so it could loosen up the muscle tissue, right? I mean, how do your shoulders and back feel right now?
Pretty good.
But from getting a few minutes of work, did that help?
Oh yeah.
Yeah.
So okay, so a little bit of work can really help, right? You can loosen the muscles, and that reduces tension, right? If somebody's tense, then they're contracting their muscles. Now you're getting the contractions to stop. What else is happening?
Helps free.
Helps free adhesions. What are adhesions?
Scar tissue.
Well, scar tissue is different than an adhesion, but
Sticking just muscles that are tight.
okay, so scar tissue is extra fibrous, right? Adhesions are extra sticky spots, right? From dehydration or from an impact or an injury, right? What else? Circulation. Increasing circulation. That is the #1 answer for the national board exam. On the national board exam, if you need a default answer of what massage does, it's increased circulation.
You're not the first person to tell us that.
It's really true. It's really true.
Hey, it's right there with the bright light.
Yeah.
That other thing.
Taking the pressure off nerves. Have you noticed that on the list? Anybody here have any nerve impingement or nerve weird tingly stuff go on when your muscles are contracted?
Yes.
So that's extra important, right? Because then you're working with more than two systems. You're working with circulatory system and muscular system and nervous system. right? And what else? What else? What else should be on the list?
Assists the venous return, especially when used in a centripetal direction.
Good. What's centripetal? What's
Towards the heart.
Towards the heart. So assisting venous return, which is different than Saturn return. Right? There's astrologers out there.
Astronomy.
No. Yeah, astrology. Venous return is bringing the blood back to the heart, right? So your muscles milk your blood back to your heart, and if you're milking the muscles, you're helping the blood go there easier. Make sense? Which is the reason to do it in a centripetal direction, because why would you want the blood to go to your hands and feet? Then you would just be walking around with big bloody hands and feet.
In the hospital though, if someone had chloroplast circulation and we were doing clinical therapy, then would you want to do that if you see me have blue feet? Once I think Paul had blue feet. We were sitting in a big circle and his foot looked a bit blue.
Oh.
So then you would want to work towards their limb.
There are some advanced modalities for moving,
If someone has like really severe.
moving
like,
fluid or blood in particular directions for a reason.
Yeah.
But in this modality, you're going to use it all centripetally. If somebody's got a circulatory issue, then you can, then it takes specific work with that person. You know what I mean? So if anything's going on like that in class, tell us.
Yeah, you wouldn't want to do that.
If you see any blue feet, we need to know that.
But the other day.
Okay, but Paul, we'll take care of Paul.
And do we just don't ever do massage on our stomach? Abdomen, is that not safe?
Just not on the second day.
I never had my abdomen.
Right. So we're gonna actually have a whole day of chest and abdomen. Not breast massage. No breast massage. We're gonna work with. So actually, let me take a wide angle view here. So today, the focus is on this stroke and how to use your hands in this way. There's also a lot of focus today on draping. And so that's probably a big piece that's missing for you, is that how would we keep everything covered and not uncover things, and you know what I mean?
What part are we doing? The body?
Today you'll mostly work with legs and back, and in the demonstration you're going to see how to do draping. How do you use the sheet to keep everything covered? How do you undrape an area that you're working with? How do you get your client to turn over and hold the sheet for them? All that kind of stuff is going to happen today. So that should take a lot of pressure off in terms of how would we work with certain places. Like if we're going to work with an abdomen, we need to uncover the abdomen without uncovering the chest. Right? So there are all these mysteries of draping that will be revealed to you today. Right. Yeah, I mean, it's nothing exotic. A towel can fix a lot of things. And so what's the final thing that should be on that list that just isn't on the list? Feels good. Just feels good, man. That's why your cat does this. Have you ever felt really bad and your cat gets on you and does this to you? Yeah, they do that thing. It's okay.
It would be better without the claws going in the teeth.
Yeah, the claws in the track.
Well, good point. Make sure that your nails are clipped. Right? Clip your claws. And also, that's the other reason for not gripping in, because you don't want to dig your nails in. Right? So, for today is also your first demonstration where one of you will be,
Not you.
where Roberta will be the person on the table. So this is the thing though, so you have to be, are you willing to, are you willing to be this demo is also a lot about draping. And so you're okay with
I'm okay.
disrobing and having draping be
Yes.
done? Okay. Okay? Well, that's
You got
great.
picked on mine today.
I mean, nobody's. Yeah, we keep it out of that realm and make it. This is a clinical application of body work. So, so that's specifically the focus of the demonstration. Okay.
So is that why we brought this out then? We're gonna do all three? We're gonna use the towel and sexual.
So if you could, you and your partner set up in the middle of the room, please. And pick a new partner today. Brand new body to work with. And let's go. Yeah, tables, partners, all that stuff.
I'm sorry.
I know.
Set up tables with your partners. Put all your
About tables and draping, bringing people into your office and things like that, because I'm assuming for most of you it's not a familiar event. So in my office, I always have the table set up for my client before they come in the room, so it looks neat and clean and tidy, and that I'm not doing what I just did, which was like come in and scurry around with them and try to put the sheets on the table. And it looks something like this: the bottom sheet, the top sheet, somehow folded back, especially if they're the same, the top and the bottom, which they often are. I like them to see that I'm going to get in between them. So I make sure that it's clear that there's two sheets. Sometimes I have a blanket on the table. If it's cold like today, I would already have the blanket on the table, because most people will be cold once they lay down. But if I know them, and you know, like I was telling somebody yesterday that some of my clients have like their sheets, at least they think they're their sheets. And but they're the ones they like. So I always have a selection of different kinds of sheets. I have flannel sheets, I have cotton sheets, I have, you know, thinner, thicker, bigger, smaller, all sorts of different kinds of sheets. So it's nice to have a selection, and then as you get to know your clients, they'll start to tell you what they like. And then it's really nice to hear that, pay attention to it, and put those sheets on next time they come in. And they always appreciate it.
You still have to wash them all in between every session, no matter what.
Each client gets a new set of clean sheets. So you have to have lots of sets of sheets, and you learn to do sheets almost every day if you have full regular practice. And one of my clients came in last week, and I had just done laundry, and I had forgotten to bring my basket of sheets in, so I had a limited supply, and she said, "Where are my flannel sheets?" Sorry, they're at home. So I do get kind of attached. But so I would bring my client in, and if it was a new person, then we would sit down. I have a seat for them, I have a table for them, I have a clothes rack for them, and then I have my desk, and my chair, the massage table, an extra rolling chair, a cabinet full of sheets, a pile of pillows, blankets, towels. There's all sorts of things. Have whatever I need, I have there available for me. So I invite my client to sit down, and we would go over the intake. So if she had filled out an intake sheet, she was a new person, then I would look and ask follow-up questions, and we'll do more of that later when you're not learning so much. Do it when you can actually take in that information about how to do an interview and intake. But we would determine together what kind of work we were going to do, what areas of the body needed attention, any expectations that she had, to make sure I could let her know if I could meet them or not. That's always important. And so then we would figure out what we're going to do, and then I would show her how to get on the table. Because even if she's received massage before, if she hasn't received massage from me, I'm not sure what she's been told in the past. So I say something like, so I'm going to leave the room for a few minutes. I say that first. So that way they're not over there wondering, am I going to have to get undressed in front of her? What's going to happen? You know, who knows what they're thinking. So the first thing I say is, I'm going to leave the room for a few minutes, and while I'm gone, if you would undress to the level that's comfortable for you, and you're going to get under the sheet, and I actually lift it up, because I've had many times People, I come back in and they've heard nothing of what I say because they're all nervous. And they're on top of both sheets and they're upside down or backwards or who knows. So I try to make it clear. And I try to say things twice in different ways too. So you're going to get under the sheet, between these two. And I'll have you start, however I'm going to have her start. I mean, they're going to say, I'm going to have you start face down. Okay. And your head would be in the face cradle. Or I'll have you start face up, meaning you're laying on your back and you're facing the ceiling. Okay? If you say things like, I'm going to start on your back first, they don't know if they're supposed to get on their back or you're going to work on their back, so they should get on their stomach. So you have to make sure that you're clear about how you want them to start. Okay?
So specify their position, not what you're doing.
Right. It's usually better that way. If you say what you're doing, there's, at least in my experience, there's been, it is more confusing.
Gotcha. Okay.
Say, so there's a rack for your clothes over there. There isn't, we're just pretending. And I'll give you plenty of time to get ready and I'll knock before I come back in so you don't have to worry or get startled. Do you have any questions? And a lot of times the follow-up question is for a new client, well, how much am I supposed to take off? And then my answer is whatever you're comfortable with. I want you to be comfortable. That's the most important thing. I can work around anything. The least amount is best because I can really access muscles better, and I really want you to be comfortable. So some people take their underwear off, some people leave them on, some people take their bras off, some people leave them on, some people leave their boxers on, some people take them off, and I give them some suggestions about what other people do. And you can do whatever you like. Okay, so, and then I also say, as I'm working, what I'll do is just uncover the areas that I'm working on. So for instance, if you were laying on your back and I was going to work on your leg, all I'm going to do is just uncover your leg, and then when I'm done, I'm going to cover it back up. And when I'm working, say you're face down and I'm working on your back, I'm just going to lower the drape so that I can access your back, and then I'll cover your back up. So what happens in the end is you stay more covered than you would normally in your clothes. Okay? So that way they get the idea that, you know, I'm not going to come in the room and go, okay, well, I'm ready now. Right? People have like ideas about what happens in massage rooms, so I need to make sure that they know what's going to happen, what's not going to happen, and you know how they can feel safe. I want them to feel safe. I want them to feel secure and snuggly. And it happened once, actually, to me. I was when I took the exam, we used to have to do practicals and get videotaped, and then they would watch it, whoever the big powers of the people were that gave you your license or not, and they would watch it and determine if you did the Swedish massage strokes and you did the draping properly, and give you the pass or not. And so how it worked was you would go in and do yours, and then you became the body for the next person. We were all just like lined up in the hallway. And so I did mine, and then I laid on the table for the person that came in after me, who I didn't know, who was really nervous. It was hard not to be nervous. I mean, this was like, you know.
This is from all different schools too, right?
Yeah. And at that point, you had to use just towel draping. You couldn't use sheets. So you had to use what was called diaper draping. So you make your towels kind of into big diapers, you know. So that's what you have. Yeah. So you have like comes up through your legs, you know. And then you have one for your chest. So I was all draped and everything, and they came in, and she was so flustered that she just kept looking at me like I was supposed to do something for her. And I was like, oh. And so she put on the oil, and she put on so much oil that she realized it was going to be too much to be able to do petrissage and the strokes that she would need to do to show them that she could do this. So then she was looking at me like, oh, shit. So, you know, it was like all this oil, and I'm just like, oh, I'm so sorry. And so she's like, what do I do now? You know, I mean, she didn't say that, because she was trying to not say things like that. So she took the sheet that was my diaper.
Oh! The towel.
Pulled it down and wiped my leg off and put it back up. And I looked at her, I said,
You know.
Oh, you're in
You
trouble.
just blew it.
It was being filmed.
Yeah.
I'll never know what happened to her or if she got her license.
Not that time.
Someone watched it.
How low did it go when she pulled it down? Well, all the way up.
Hey, it was-
It wasn't like. Yeah, because it's, it's just like comes up to your waist.
Whoops.
So it does happen.
You have your underpants on you?
I think I probably did just because it was, I had to jump on the table.
Right, right.
I just know that it
Thanks.
felt really bad.
Thanks for getting that oil off my leg.
I think we're not done.
Yeah.
So anyway, all right. So let's see. Questions so far? How to set up the table? How to introduce your client to your table? How to tell them to get on the table? Anything when you are having clients that have either worked for you or were uncomfortable for you?
One thing I really like, especially when you're just learning things new, is I like when you're laying in a supine position and they get one of those really nice, sometimes they're fragrant, sometimes they're just flat, and put over your eyes. Something nervous about watching them and you're looking at their arms like going this way. So not even having to look at them and trusting it, it's really nice when they cover your eyes when they're coming around.
So you like
And then they
eyes
just say, I'm coming around, and
Yeah. So that's something you could offer. For some people, that would be really scary. So but I think some people will also like it, but other people won't want to be
watching them
Trapped.
makes me nervous like that.
Yeah.
Watching
I like
everything
to
they do.
watch.
So for you as a client, that would be something you could have. Just, that work probably for you. I imagine it just keeps you less distracted. Okay. What else? Anything that didn't work for you as a client?
Yes, I had a massage, and I just recently found out someone from the school, but his fingers were so hairy that every time he touched me a certain way, it wasn't the tickle thing. It was like it made me kind of feel like I don't know. It just, he was so extremely hairy. I think he should maybe
Shave his hand.
not shave, but
Cut
the
it
rib.
Oh, wax.
But that was just something that, I don't know, I think if my hands were that hairy, I might would just say something like that beforehand.
Okay. So that's the way you could get around is just to mention
Because
to them.
it's that way.
It's free
I wasn't
hair
prepared
polish.
for it.
And I usually mention that my hands are usually cold, because they are. And even if I go and warm them up, by the time I get back, often they're cold again. So I do let them know ahead of time. Most of my clients are used to it by now, and some of them actually like it. It's kind of an icing treatment. And some of them don't like it. Try to warm them up if I can. They're cold right now.
And you have another hand.
I was just gonna say, it doesn't really apply right now, but I had several massages, like the girls or the guys had like a pouch and they have like their massage wheel right here, like by their side. And it makes it like more convenient because I've had another one where the girl set it across the room and she would walk across the room and get her massage oil every so often and go on the massage. And I got about like 10-minute massage out of the 30 minutes because she took so much time to walk across the room and
Yeah, like she's walking a little too slow then.
Yeah.
Good point,
I
though.
like it in arm relief.
I like it when they have the little pouch and they just have it like right there.
I've had
and
them
drop
just put the oil between my legs or something like that, if it's in a closed container, or at the end of the table.
Put it in my back pocket.
Yeah, I wouldn't go for between the legs.
No, but I mean like down here, not.
Between your feet.
Yeah, between my
And those little
feet.
pouches are great, except I can't stand wearing them. So for me, it doesn't work at all. I mean, I don't like belts, I don't like things tight, I don't like stuff. So to me, that would be like wearing a,
Or just
John
wearing
belt or
that
something.
breachable place, the arms.
But yeah, so for you, you might like that. That might be something that you could try and see if that works. Yeah, and keep your oil nearby. Keep it by a table leg. Keep it on a little table nearby. And sometimes it's actually nice to just step back for a minute, let some integration happen while you're getting some more oil or changing something. So you don't always have to be doing the whole time. It's really important sometimes to let your client take a breath or two. Lots of different ways to do things. So what if a client comes in and I give them this whole thing about what we're doing and how to get on the table, and they say that they don't need to use draping?
No,
You have to.
And wired draping.
Okay, so you tell
You
them.
have to.
So my response would be, well, I need you to use draping. Okay, because first of all, it's illegal not to, and second of all, it's because it's professional. So even any, friends, family, whoever, I use draping. Okay, I keep massage professional, no matter what I'm doing. And I'm a real stickler about that. I'm probably one of the more stickler people on the staff about that, because I feel like if you want to continue to advance massage therapy into the medical field and into a field that's going to be accepted, you have to do your part. So you have to present yourself professionally, you have to act professionally. And you know what? If you do that, you're not going to have any trouble. The people that end up having the most trouble with people that are either inappropriate on the table or think they're there for something they're not, meaning some kind of sexual massage, are the people who are not presenting themselves professionally. I don't ever have any trouble with it. For almost 20 years. Never. And I have a full practice. It just doesn't happen. So I'm real clear, and I'm also real clear about doing the phone interview. Like, how did you hear about me? Don't ever go off and do I get calls from people that are in town for business trips, and can you come to so-and-so and give me a massage? And I'm like, no, I'm just not available for that. It's not worth it to me to have to go and try to figure that all out. Is it on the up and up? So just make sure, and you have to get really clear with your own verbal skills about what you are available for and what you're not available for. And make sure that so you can get practice in saying this is not a sexual massage, in case someone comes from a state that isn't licensed yet, where they still do sexual massage. They do. And so, it might be somebody who just thinks, well, that's what happens here. So you need to let them know that isn't what happens here. And otherwise, you lose your license. So, not a good deal. So just, if someone tells me they don't want to use draping, it's a red flag to me, because I want to know why it is they don't want to use draping. And chances are they're not going to get it on the table in the first place. They're going to leave. So.
Have you ever had that happen?
Yeah, I was just thinking. I was just like, I don't think so. If it was, I forgot, which is possible. But there's other stories. Do you have?
I had one time where the guy came from another state, and he just said that they didn't use draping there, and he didn't want to use draping, and I told him, well, it's a law here. We used draping, and it was fine, but, definitely had a red flag come up when he said that, and I was pretty new at massage. It was right when I got out of school, so it was a little, one of those moments that took a little bit of thought, but that's my only experience. Ever since then, never had that experience.
Good. Are you, Michael?
Well, I was just thinking, I had a female client one time that she didn't like to have her breast drape because she said her nipples were sensitive to her nipples, and she didn't want to do that. And so I got a softer towel for the towel. That was pretty clear. It was definitely weird though.
Yeah, and there are cases where you can do breast massage, and it's actually specifically stated in the law about when you can do breast massage, and it's as if it's when you talk about it ahead of time, and that person specifically came in for like scar tissue work, or people that have had mastectomies, or if you uncover one at a time, it's not like whip it all down, and so you're careful still, even if you're doing that, and you'll probably run across that because there's lots of people out there that need specific type of work, and it's really helpful. So, but you get an agreement ahead of time, and then you're just careful about your draping.
You have a hand up behind.
I've actually heard that some women can get breast implants. Sometimes need a breast massage. That's what I've heard. Just the main reason that they would ever have to have a breast massage was that.
Yeah, probably scar tissue and stuff. Just surgery.
I had to have it done to break some adhesions when I had reconstructive surgery. And I've been going to the same massage therapist for a long time. But even so, he draped across my nipple area because it was more right here. But point where you can get nauseous.
So we'll talk about that tomorrow.
Great.
How we're not going to do that with people.
Yeah, I mean, it was, but I was like, come on, you gotta, I'm like,
Yeah. You could do it gradually and
Yeah.
not quite to that level.
Yeah.
So you don't want to cause that kind of trauma for somebody. Yeah. Okay, so what we're gonna do is I'm gonna have you get on the table. And normally when we have one of you guys are here and you're all sitting around here like this, we just have everybody turn around so that the person can get on the table. And you can just be supine. And I'm gonna go warm my hands up and wash supine on the back. Like I said, when I first learned massage, we used towel draping exclusively. And now sheet draping is more in vogue. I use sheet draping now, it's just easier for me. And I feel like I can get a little bit better coverage.
As opposed to the diaper.
Yeah.
That would seem to be
Sometimes
pretty
you can do both.
comfortable.
Yeah. You don't use really bulky towels. And you can do really nice coverage for like stretching and things like that. So you could use both too. You can put sheets or blankets over towel draping. But we're just going to show you sheet draping, and then you can. There's books on draping. There's all sorts of ways to be fancy about it. I'm not a fancy draper, but I'm very good at it, and I'm thorough, and I keep people really well covered. And I really encourage you all to be that way too. Really practice it and get good at it, so people feel comfortable on your table. So I walk in the room, here she is, which is great. She's exactly how I wanted her to be. If she wasn't, if she had gotten like maybe she's her head's down here, or she was face down or something. If I had a table, most of the newer tables have a place on either end for face cradle. Mine don't. So if her head's down here, she's going to have to turn around because it won't work. So, but if she was down here and I could arrange it that I could work down here, that'd be fine. I would just turn myself around, really, okay? And again, the pillow should be under her knees, not under her head, just to support her low back. Are you warm enough? Okay, so if you get chilly, which you might as you lay down and your core temperature drops, just let me know and I'll get you a blanket or a towel or something. Yes.
So you couldn't, like, you had to have her sit you up,
Mhm.
you just leave again and let her.
I could either leave again, or she could just kind of toga her sheet and turn around. The people that, when I've come back in and they're on top of the sheets, just didn't get the whole program, then I just go to my cabinet and bring out another sheet. Yeah. Don't make them feel uncomfortable, and I try not to embarrass them or make them feel silly or anything. I just get another sheet and I just put it over them. And, yeah. So, if I were to work on her arms, they're here, all nice and available for me. So usually I go to the wrists. Sorry, my hands are cold already. And so then I can move them around as I need to. Okay? And if she had her arms under the sheet, which a lot of people do, especially when it's colder, then in order to find her arm, I come down to where I think her hand is, and that's where I can just pick up the sheet a little bit and get her wrist and just bring it out. And bring it over the sheet like that. Okay? So I don't really need to lift up the whole sheet to find her arm. And then wherever I find her arm, I put it back when I'm done. So after I'm done working then, I would put her arm back here, because that's where I found it. So kind of remember that. And that's just a nice touch. Or if she was under the sheet, I would put her arm back under the sheet. Okay. If I was to work on her legs, then I'm just gonna get the sheet off the leg. Basically, I just try to do no more than 2 folds, because otherwise it's going to get really clumpy here. You're not going to be able to get to the leg. So you can do one of 2 things. You can just tuck this right under just above the knee, and that gives it a little anchor. All right. Or if you want, some people like to actually take the whole sheet, lift up the knee, and pull it under. And again, that's kind of like the diaper effect. Okay. And we actually will do this on the days that we do show you stretching, joint movements, because we're going to be moving legs around. We actually ask you to use this type of draping where you would lift it it up, bring it all the way around, and that way it can be held here. And they can hold it, or you can hold it while you're doing the stretches to keep it tight. Okay. And again, when you bring the sheet out, just be careful that you're not like creating lots of draft, big billowy openings and things like that. You're just kind of neat and tight about it. Okay. Let's move to the other side. A lot of people, especially if they've got like sheets and blankets and all this stuff, they tend to do this because they're nervous. You guys are going to do this. And there's this whole little rolly, I'm not sure what it's all about, but and what happens is, I mean, this actually worked okay, but there's all this big wad of sheet here, and it just gets in the way. So better to just try to be a little, just do a couple of them if you can. You can get a little more clean there. Okay, see the difference? Now, if I was going to work on her abdomen, which we definitely do, and I wanted to review again, I know I did last week, but I know that last week was full of a lot of information. You may not have heard it all. But the process of how this 5 weeks goes is that each day for the first 5 days, you learn a new stroke. And on one day, you actually learn 2 new strokes. And we just vary what parts of the body. We're not really focusing on any particular part of the body. We're focusing on learning the strokes. And then after we do that, then we go to parts of the body. And so we'll spend a whole day on legs, and we'll only work on legs, and we'll apply all of the strokes on the legs. And then we'll apply all of the strokes on the arms. And then we'll apply all of the strokes on the chest and abdomen. And then we'll apply all of the strokes on the head and neck. And then we'll do all the strokes on the back and glutes. And then we've gotten it all. Okay, and each of those gets a full day. All right? And then we put the body together, and we do the entire posterior side of the body in one day. And then we do the entire anterior part of the body. Legs and feet and hands and arms and chest and abdomen and head and neck. And then we'll do a full body at the end of that, and that takes us to the end of the 4th week. So it is a layering. Okay, so and why I'm telling you this is so that you know that you're going to continually practice all of these strokes over and over again. So today we learn petrissage and draping, but we're also going to practice effleurage. And tomorrow we're going to practice effleurage and petrissage and draping and friction. And then so you see how it goes? We're going to keep just adding and adding and adding. And then pretty soon we'll stop adding, and then we'll start applying. And that's when we start doing sections of the body. So does that make sense? Okay. All right, so if I was going to do some work on her abdomen, I can't just take the sheet down, can I? No. Yeah. So I bring the towel out. This is a pretty big towel. Yes, it'll work. Wouldn't want it any bigger though. So I'm probably.
Mine's a lot smaller under there, Anne. Do you want the other one?
Well, it's all right. So I'm going to do it this way, the long way, so it's not so fat. Okay, and I'm just going to place it over her chest, and I'm going to give it lots of room for error here. Like, I know her breasts aren't this big, right? But I want to make sure I can adjust it later once the sheet's down. Okay, so I'm just going to lower the sheet under this towel so that I can work on your abdomen. Okay, so I let her know what I'm doing. All right, it's not any big surprise. So I'm just going to pull the sheet and hold the towel. Make sure the towel doesn't come down. And I'm going to bring the sheet down to the ASIS level, or her underwear. Okay, if she doesn't have underwear on, then you go to the ASIS level. And I'm going to tuck it in, if she has underwear on the sides, not in the middle. All right? Now I can adjust the towel. Okay, so I'm going to roll the towel up, and then I'm going to bring her arms around, so that gives her like a little more of a secure feeling. Keeps her breasts from falling out the sides. And then I can roll down the top here too, because then I could do some chest work as well. And now I can work on the abdomen. Okay? Does anybody need to see that again? And then when I'm done, I just get her hands under there, and I bring the sheet just over everything. And sometimes I just keep the towel there, depending on the person, or if they feel cold or whatever. But if not, then all I do is I've got to lift her arm a little bit to get it out from underneath. And then I'm going to hold opposite. I'm just going to pull on the towel. Like that. And try not to do like a cross face, which is easy to do. Any questions about that? Right, so now let's talk about face cradles. So we haven't really used them yet. We didn't need them yesterday. And like I said, you can use pillowcase just fine. And you can do it several ways. If you want, you can just fold it in half, long ways, and then you can put it on the face cradle. Like that. Okay. Ta-da. You can also do it a little more fancy if you want. These are all just way too much work for me. I don't do these. But I like to show them, because some people really like them. So I just did 2 folds. If you fold, you know, it fits better than just the 1 fold thing. Or, my favorite way is that I just put it on here. Like that. Kind of tuck it under, and I feel like it covers the vinyl a little better. Like that. And people then adjust their face on it so they don't get in all the wrinkles and stuff. What you don't want to do is put it inside. Although it looks like it would really make a nice cover. It can't breathe.
You can't cover the legs anyway.
So, not really going to work. Okay? You can also use one of these. Oh, sorry. Which are the fitted ones. I like these. I have several of these. I have lots of different things. Sometimes I use these. Sometimes I use the flat ones. Flannel ones. Which are never as pressed out as they are when you first buy them. Does anybody have a flat one so we can show it? Oh, look at that. That's cool. I haven't seen this design. So this one just goes on that. So that's an easy one too. I like these. When my mother comes to visit, she irons all my face cradles for me. Very nice. Otherwise, I never do it.
But isn't it like a pillow, so there is an outfit?
Hmm?
Just lays across, not like a pillow.
Yeah. Is this one yours, or is the yellow pillowcase yours? Oh, this one's yours. So we'll just keep using this one then. So I would move her hair, make sure it doesn't get in the face cradle thing, so that she rips it off when she turns over. And then I have to give her instructions how to turn over. All right, so what I need you to do, Roberta, is you're going to lift this shoulder and turn away from me. And just turn over under the sheet. I'm going to hold the sheet down, and then you kind of spiral up into the face cradle. Okay, whenever you're ready. Okay, and then I look and make sure that the pillow is in the right place, and it almost automatically adjusts to the right place. I just need to pull it down a little bit. Like that. Okay. So she's all set. And now I would lower the sheet to work on her back. Just lower the sheet down. And again, we're going to take it down to either the underwear level, where I would then tuck it in. Is it okay if I tuck it in, Roberta? Okay, scoot it down a little bit. Okay. And then I would scoot it down right to the top of the gluteal cleft, which you have known formerly as your butt crack. Okay, if she doesn't have underwear on, then I just fold it down to the gluteal cleft. Okay? And then, so if I did that, pretend like that's happening. If I wanted to work, like say I wanted to do petrissage on the glutes, or I wanted to work specifically on the glutes, then I could fold back just one side at a time, and I would be able to work the glutes pretty easily. Keep her nice and covered. You'll find out that in order to do good low back work, you really have to do work on the glutes too. They're not like separate. So if you look up on the muscle charts, maybe Doug could go point out what I'm talking about there.
What are you talking about?
What are you talking about? I was talking about how if you're going to work on the lower back, how that really does include the glutes.
Oh, yeah.
It's not like they're two separate pieces of your body.
So you can see how the glutes run up into the low back. There. And combine into the same tissues of the low back muscles.
So you really have to, just see how it's, and we're going to start talking about this more and more, how we're just these continuous pieces of connective tissue that just move throughout the whole body. And it's, we divide up the body for teaching purposes, but our body's not divided up. So that's why, people will often say, I'm not sure why my back's hurting. It's the leg that I injured. So you pull out the muscle chart and you say, this is why, because it's all connected. And you show them, or you can even use a rubber band and show them if you pull on one side of the rubber band, what's going to happen on the other side. Or you could even use a sheet. You could show them, if I pull on this side of the sheet, it's going to affect the sheet up there. Whatever you need to do to kind of educate people why things are happening in their body and how they can also be helpful and proactive and remaining healthy and doing the work they can do to keep themselves that way. So back work. So then if I was going to do legs, again, I would just fold back the sheet. Just a little bit this way. And I'm going to tuck in just above the knee again. And then I'm going to go up to where her underwear line is. Because for now, that's her boundary. Okay? So I can also do some glute work, working on the legs. And again, look up there. They're not different. It's just the extension of your leg is your glutes, which is why, you go on a long walk or a hike and your butt hurts the next day if you're not used to it, right? So now you can see why that's true. Okay. So now, the turning over seems to be something that's hard to grasp. And I try to make it as simple as possible, but basically all that she's doing is turning in a complete circle. Okay, so I was standing on this side and I had her turn away from me. And do you know why that was?
Because you're holding the sheet tight. She
Right.
has to pull away.
If she had turned it this way, she would have brought the sheet with her. Right? So if you get confused about which way to tell them to turn, just do it in your head first and see if the sheet stays on. Right? So now that I'm on this side and she's going to turn, I'm going to have her turn to be supine, she's just going to keep going in this circle because I'm holding here still. Yeah, go ahead. So you're going to lift this shoulder and turn away. Turn towards me, sorry. And then you have them scoot down. A lot of people just keep their head in the face cradle, so you got to continue to scoot down.
I probably should have asked this question before she turned back over, but assuming she did have underwear on, and when you pull the draping up, is there an imaginary line that you go to? Or?
Yeah, and I'll turn her over again, and then I can show you. Because I like to show this a couple times anyway. All right, so that was a great job on the turning. The other, let's see, some people, I just want to show you some variations. So you can hold towards you. Some people like to hold away, but I would really ask that you not do this in class because there's other people in the room. Like if you're in your own office, you could do this because there's nobody over there. But if I were to, and I'm not really going to do this, but if I were to lift up this sheet, then you guys are going to see her underneath the sheet. I wouldn't see her. So you could do this alone in your office. But I don't like it, and I have to bend over and reach the other side, and I try to save myself. So I usually just hold here. I'll hold it down towards the table, and then you can lift your shoulder and roll away from me. Suggestions about what other people do. Okay, great. Check the pillow again. Oops, sorry. Okay, good. Okay, so if she didn't have underwear on, let's work the legs. going to, again, I'm still going to tuck just above the knee. Or, some people like to really bring it all the way through. That's also fine. So you have to lift up at the knee and just kind of pull it through if you want it to be more snug. And then I can really, I could go, if I wanted to do like a full body stroke or something, that'd probably be my delineation. Going right up to where the greater trochanter is. Okay.
Is there any reason you would prefer to pull it under or not?
Some people think it feels more secure. I don't think I usually do it. I do it if I'm doing stretching, and I do pull it through. But if I'm not, if I don't, I usually just tuck it in.
Can I ask a question?
Yep.
I got a massage, and the guy Neil, he actually graduated from here. He's a very far out. And when I was like laying on my back, he would hold it down like this, and then just ask me to roll. So that he would just hold this down and say, okay, now I'll roll over. And
Then it wouldn't matter which way you turned.
right, so
That's
I'm
fine.
if that's okay, you just would hold it really tight, and then there's barely room to really roll. If you
Right.
hold it down
Yeah, you
really
have to
tight.
hold it down tight, or else there's no way you cannot get
So that's
exposed.
professional and fine too.
It is. I don't usually do it because the people that I do it to, they tend to grab onto the sheet and like hold it like I'm gonna be looking at them or something. And I understand that, So, I don't usually. I just stay to the side and let them have a little more room. But that works.
I also don't really like something at my neck, and that always
So,
feels
like,
tight to me when someone does that. And I, just in an open room, I'd rather they just turn away from me, and I'm not holding anything at their neck. So
I would try them both.
I thought something you graduated here.
try it in class and see how you feel about it.
Yeah, there's a lot of different ways.
It was
People
fine
that
for
create their
me.
own ways. And I would see how it works for you, see how it works for your client. Yeah, just try them. Try different ways. Yes.
What about guys, with boxers, they leave their boxers on, you move them up?
Yeah, it's challenging because you can't really get them up that far. So it's just pretend like Roberta had boxers on. And so we'd probably be to about here. So they're here. So you tuck them in underneath, and then you ask if you can scoot them up. And then you get them up as far as you can get, which is probably going to be about to there. So they're just not going to get this upper leg glute work. You can do stuff through the draping, but you won't be able to. Right, and you don't want to go up underneath people's underwear because they have them on for a reason. Okay?
Yeah.
Yes.
Can I put a towel on top of that area where the sheet is rubbing over to make sure it doesn't slide off?
Sure. Put a towel on top of an area to secure it.
I have a question.
Yes.
I don't know if this is the appropriate term or not, but when I use a face cradle, my eyes will swell shut. And I don't know exactly the reason it happened. It's happened multiple times. So are there alternative ways that we could support the head or anything face down that would work instead of that?
Yes, people who don't like it, they can either use the face cradle and just turn their head to the side. So they're using it more like a pillow. So it's kind of like she is right now. Or she could scoot down and go ahead and scoot down. And you would just have her be on the table like that.
And that doesn't affect the...
It does, but there's no other, you can't just have her hang her head off the table. So, yeah, there's no other way that I know of that you can have her face down without being face down.
Even those body pillow, the cushioned pillows still do that. Same.
I mean, I've made up things like when I've been at people's houses and I've been trying to do back work and there's no table or anything. We'll take like towel. Can I use it? It's a nice towel. And you can roll it. And then you can make face cradles. Like this. You could try that. I don't know if it would have the same effect or not. Have you tried this? It may not be as smushy
Yeah,
as
it's
your
not
head.
as tight in here. It's a bigger
open space.
And then you can kind of like adjust it to your own width or.
Let's see that, Ann. There you go. Oh, that's so
Adam,
cute.
I see Doug.
Like romper room or something.
I'm into romper room.
Yeah. You went
You
to
went
romper
to it?
room?
Dating myself, yes.
You
Really?
did?
I did.
Man, that's
It
awesome.
was very
I
exciting.
wanted to go to romper
I
room.
know. I just wanted him to call my name.
I just did.
I know, I feel fulfilled now.
Okay, one more time. We're going to lift the shoulder, turn towards me, and scoot down out of the face cradle.
That's awesome.
Okay, so that's it for draping. Feel pretty okay about it? So today we start using draping. We'll use it from now on. And just undress to the level that's comfortable for you. And we'll start working with it and getting good at it. Okay. So now that she's on her back, I don't need the face cradle, so I do put that away. Here. And
And my intuitive senses are telling me that it's this side of her body that needs to work today.
according to the camera. Do you have any injuries or chronic pain or accidents that would be useful for me to know about?
Just, I had my lower torso and my lower back, so.
Okay, so you have lower back pain a lot.
Yes.
How's that feeling today?
It always hurts.
Always hurts. Ever since?
It's constant ever since
can
I was
remember?
born. I was born with it, so.
Lordosis. So if you see, like if you, and maybe when you get up, we
If you
can
put
actually see.
your hand under my back, there's a huge bump.
So
I'm
it's
always
a-
off the table. I'm never.
how her spine was developed. Okay, so I'm going to start on this leg. Is that okay? All right.
And
Yes.
for something like that, would it be advised to like roll a pillow or a blanket or towel and put it under her back for additional support?
If I I would put more on your knees.
Yeah,
Do you want another pillow on your knees?
It's fine.
Well, would it
You
be more
take this
comfortable?
one.
Yes, I will.
No, let's do it. Can I use this? Is
Yeah,
this-
that's mine.
So to put more pillows under, this is a good point actually. So I don't want to like take off the draping either. So usually what I do is I just reach under and then just have you lift your knees and then I just scoot it under here. Adjust it. Does that feel better?
Better.
Okay, good. Yeah, make yourselves comfortable.
I've had people roll me to the side and do massage that way, especially when I was pregnant.
Yeah.
So-
Yeah. Anybody pregnant in here?
Besides Laura.
We are going to actually add in a sideline day. It'll be an afternoon class. It'll be voluntary, just to show you how to position people on their sides using pillows, things like that. So it does come up, and it may come up before you get it in connective tissue, so it'll just throw it in. We don't have that date set, but we're going to have that date set soon. All right, so I'm going to uncover your leg, Roberta, and go over some effleurage, and then show some petrissage. Okay? So feel free to come around. So again, you're looking for your dime or your nickel worth of oil, depending on them, too. You know, how oily they are, how much hair they have, the day, is it hot, you know, is it humid, is it dry? Those are all factors. So don't get real exact, like I always put the same amount on, because everybody's really different, okay? So I'm going to use one hand for just putting on the oil on the lower leg, and the other hand's just going to put the oil on the upper leg, and then I'll just get that right out of the way.
So you both on the bottom, then
I think
oil,
it's
oil,
more to do the
oil
top
on the
half of the
bottom
leg.
and then on the top.
Right.
Yeah.
So I'm in my stance. I'm going to sit back into my little chair here. I'm going to push my back leg into the ground, and that's going to start propelling me forward. And I immediately let my pelvis follow my hands, pushing my hands. I'm transferring my weight into my forward leg. And so now you see my pelvis is still right here with my hands. Okay? Let's try that again. Pushing the weight, transferring from my back leg to forward leg. And you can let me know if the pressure and all becomes too much. Or if it's and this is called
I really like that.
and this is called draping. Supporting my thumbs. Okay, so any questions about effleurage? Okay.
Just stripping one more time.
Sure.
You're supporting your thumbs,
Yeah. Keeping them close to my fingers, so I'm not way out here by themselves. They're getting their support.
They're in line with your fingers, wrist.
Right. Yeah, so I'm not dragging them.
Right.
That.
Are you following suit with your right?
Yes.
How would you go around the need to come up?
I can just lighten up and then go over, or I could go around.
Around.
I wanted to do that, or if I wanted to go right into. I could do some shingling.
You just want more,
this
Roberta.
way.
I was trying to do that yesterday and I didn't know how to go around.
It's kind of like driving on a dirt road. You just kind of go where you fit. Or else you end up
Or stuck.
so you just feel, you sink, you turn, you move. There's no exact way.
Low gear.
Okay. All right. So if there aren't any more, yeah.
So whenever you're trying to put most of your weight into, like, is it okay to put your hand right here and just kind of push
Yeah,
down,
yeah.
or is that bad?
Sure you can. I do that.
Okay, because mine was kind of like right there, and then I was like, oh.
Yeah, that's fine. And actually, I think I was telling somebody yesterday. I think it's a good teaching tool to get you to use your pelvis,
Yeah.
because you have to move your pelvis,
Yeah.
or else you become unattached. So if you're having trouble with that whole getting the whole moving your body, and you tend to find yourself out here, right? So you can try that. You can attach yourself and just push your pelvis. Okay. So let's move on to petrissage. And the first thing is for all of you is to learn this groovy new dance called the petrissage dance. So you need to stand up. So this stance is a little bit different than effleurage. Effleurage is this way, right? We're going to do petrissage, at least the two-handed petrissage we're going to do in this position. So my feet are slightly laterally rotated, meaning they're pointing out, away from the center of my body. Okay, and I have a wide stance, about a little more than shoulder distance apart. And that also depends on where your client is on the table. Because she has two pillows, she's a little higher than she would normally be. But so I just make that adjustment in my own body. And then what we're going to do is put your hands on your ASISs, and you're going to move your left ASIS towards the center line of your body. So you're turning. And in order to do that, what you have to do is bend your right knee and pivot on your left foot. And then you're going to turn and you're going to do the opposite. So your right ASS is going to come around. So you're pivoting on your feet, bending your left knee now, and you're coming around, pivoting on your right foot. And then you go back. And then you do it again. See, as you bend your knee, it takes your body down. And that's going to become your stroke, actually, in this. so you can kind of see as I start to do this, what's going to happen. I become the cat.
Bless you.
So I'm going to put my hands on her legs now because this is going to be a two-handed petrissage because this is a larger muscle group. And as my ASIS goes in towards that center line, that's my compression. So I'm pushing down. As I come away, this is my lift. Compression, lift, compression, lift. And you just do one at a time. You don't have to compress one side and lift the other. So it's like 1, 2, 3, 4. 1, 2, 3, 4.
How's that?
No complaints.
So you're really trying to lift the muscle away from the bone, which is why you're trying to have no space here so that you're not sliding. Otherwise, although this probably feels good too, this is really called, this is a form of effleurage because I'm sliding over the surface of the skin. See the difference? Yeah. So petrissage, you do a two-handed petrissage on a larger muscle belly. Try to do it this way. The circular petrissage that I'm going to show you, you do more sliding because you use that on flatter muscles. And I'll show you that on the back. What about here?
That's what I was wondering.
It's bony. Yeah, I'm not going to do petrissage here. This is more like effleurage and friction. Okay, I can do petrissage on this part when I turn her over. On the part that has the muscle belly. Okay?
Lift the outside of the
Again,
the bottom.
it's just, it's not really worth it. Just use other strokes.
Gotcha.
And I could do the rolling on the extremities. Talked about that in the talk. So you're going to take your hand on either side. Okay. And it's a good way to kind of get circulation going. It's a really good move to use, especially if someone's more sedentary.
Are you using a good amount of pressure as a movement? Or is it more just about just the movement?
Well, it's not jostling because we're going to do that in vibration day. So I am trying to make this contact on her skin too. I'll show you when you're on the table. That would help. Okay.
And that was
Rolling on extremities because there's also skin rolling. I'm going to show you that on her back. So one more time. The expert turner over, Roberta. This shoulder, just turn over. And I'm going to take, do you want me to take one of these out now?
You can.
Good. All right, good. Now try not to get too caught up in how complicated the back might seem because it's a large area and it's like, oh, what would I do here? What you can do is use a pillowcase or a small hand towel. Bert, I'm just going to set this on the back of your neck. And just tuck it in like it was a article of clothing or something. Just gets it nice out of the way. So with effleurage on the back, I'm going to use the oil. I want to get the oil on evenly. So for the first part of the back, I'm just going to use my fingers. And then as I get to the lower part, I'll bring my palms in, and that'll help distribute the oil a little better.
But you're not going under the sheet.
Right. There'll be other modalities where you'll go under the sheet, and you're all going to freak out because you're going to say, they told us never to go under the sheet. But it's with intention and purpose, and it's clear. But for now, I'm going to use that as our boundary. So I'm leaning my knee against the table here. I'm in my regular stance. And I'm not, don't lift your head up, Roberta. I'm not going to straddle her head for obvious reasons. But you'll want to, because it's an automatic and then they lift their head up, and it's not going to be a very fun experience. Okay? So coming down, up, going on either side of the spine. Pushing my knee against the table to bring myself back up so I don't strain my back.
So if you're spending a lot of time on her shoulders, on the neck, would you then get a stool or a small chair?
Not really.
You don't
Because
use
I
your
want to
chair
use my
much?
body weight. I do use my chairs for head and neck work and feet work. Sometimes hand work if I'm going to be there a long time. And, you know, occasionally I could do that, but I don't want you to get in the habit of kneeling or using chairs to work on the upper back because I want you to get a sense of how to use your body weight. So on the back, this again, shingling. Show you skin rolling. So you're going to start here, and you're just going to anchor with your fingers, and bring your thumb like you're trying to roll the skin up underneath of it.
And that's petrissage?
Yeah, it's a form of petrissage. And then I just kind of walk my way down like an inchworm. See how it's rolling under my fingers?
Creating a skin wave.
Right, skin wave.
She's chuckling.
Okay. So petrissage on the back. Well, we did a little bit, right, in our circle this morning. So you can use thumb and finger up here on the upper traps, because I can really get a good lift with my thumb and finger. And when I'm doing that, I'm going to be in my regular stance. I could also use one-handed. Compressing, lift. Compressing, lift. I don't usually have enough room for both big hands because I end up over on the shoulders. Now in the flatter muscles, like you're going to learn probably today or tomorrow, one of them latissimus dorsi, you'll do the more circular one, and there is a little more sliding on that. And see how I'm making circles?
We're getting all of my little knots out.
Yeah, she sounds like she's feeling
Okay,
stuff.
so you can see I'm still using the dance, right? And I'm in the petrissage stance now. So my ASIS goes in. Okay. Now about glutes. So would you be comfortable if I lowered this side a little bit?
Mm-hmm.
So I'm going to lower this side just a little bit. It's a little bit harder with underwear because the other side tends to want to pull it up. So you kind of just have to work with it. You can also do it through the draping. If that's a way to do it right.
You always keep comfortable communication, you know.
Right. So I'm just not like ripping down her clothes. But I'm letting her know. And it's her choice. You know? Never had anybody say no. I mean, it's just the intention and the purpose behind it is pretty clear. So then I can do petrissage.
So if she had a Buddhist fair, which I have one right there, you just skip that whole part? Or
Yeah, I'd ask,
go around?
how's this bruise? Is it sore? If it's not sore and it's more than a few days old, it's actually good to do the work because it'll help the blood, because it's just stagnant blood. If it's sore, then yeah, don't do it. Anything that you would like to see again?
do the rolling on the arms as well?
Oh, you mean like this way?
Yeah.
Yeah, and I would probably do it with them supine, so that I'm not lifting
Pulling
up
their
her
arm
arm and
backwards.
pulling it. Yeah.
Gotcha.
Same with, you could do some petrissage here, but most of the work that I do on the arms is with them supine, because I can move their arm around better.
Did she bring your free lunch today because she was,
Everybody will get to be the demo at some point. So I'll take this off now, Roberta.
I have a quick question. Yeah, I had a shoulder injury, and my doctor would lift my arm and pull it over my back to get into my shoulder blade. And we'll be taught about that?
Yep.
Okay.
Yeah, we're going to show you that on back day.
Okay.
I'm not going to show you now because then there's already enough to practice. But yeah, we're definitely going to learn that. So cover her back up. Ask her how she's doing. Okay, so you want to practice? Have about 15 minutes.